So we have an important panel this afternoon, particularly poignant time in our community, looking at cannabis and pain, and particularly this subcontext of an alternative to opioid overuse. So I'm going to introduce our panel first. We do have an open Q&A at the end for 10 minutes, so please do reserve your questions till then. So I'd like to welcome first Dori Dempster. She is the executive director of the Medicinal Cannabis Dispensary since its opening in 2008. She is a cannabis patient and advocate, a wife, and a proud mom of 3 grown sons. She started working in the cannabis industry in 2005 at the Vancouver Seed Bank and moved into the Medicinal Cannabis Dispensary 3 years later with Dana Larson. And they now serve over 6,500 members in their community at 2 locations, including a mail order option, reaching across Canada. The first store, of course, at 880 East Hastings in the Strathcona neighborhood, serving the downtown east side, and the second, 1182 Thurlow, with a beautiful garden. So thank you, Dori. Our next panelist is Dr. Dave Hepburn. He is an award-winning syndicate columnist, featured in several major newspapers across the United States and Canada. Has won a number of prestigious awards, served as a doctor in the military, and was a co-host on the Oprah Winfrey Network, served with a number of Olympic committees and Commonwealth Games, and serves on a number of board of directors and associations that advance the understanding of cannabis in the medical community. So I'd like to welcome Dr. Dave Hepburn. We also have with us today Philip Kwong, a 26-year-old entrepreneur and one of the owners of Acquire Mobile Solutions. He was diagnosed with relapsing remitting MS and began a pharmaceutical treatment, but ultimately there didn't prove to be any obvious improvement, and so is focused on exploring cannabis concentrates as an alternative means to give him some reprieve from his advancing MS, and really looking at creating some real opportunities with his company, Holistek, which seeks to develop clean and medically tested concentrates for the treatment of MS and other patients. So that's wonderful and amazing. And then we'll also introduce Cheryl Rose, the mother of Hayley Rose, Canada's first legal underage MMAR patient in 2008. As co-founder of the Hayley Rose Foundation, she advocates for patient need for fair access, vital cause and dynamic in our community, and has been instrumental in really some amazing transformations within the medical field regarding protocols and training for administration with Vancouver Coastal Health and public schools and outreach programs in care homes and hospitals. Really great work. Thank you. And she utilizes her personal experiences with Hayley and other patients to create methodologies to assist patients and doctors in finding individual cannabis regimens for children and adults with epilepsy. So let's get right to it. Time is short, and this discussion is very, very interesting. So I'm really eager to engage our panelists of advocates and professionals and patients. So the subject of cannabis and pain and using cannabis as an alternative to opioid overuse is, again, really important because our community is in crisis. People are dying. For real in our community. 4 people every day from illicit drug overdoses in BC, and these numbers are climbing, particularly this last week. And we really need to engage this subject, change the dialogue and dynamic, because this is a crisis that is the most tragic public health concern in decades. So, being front line in the downtown east side, Dori, you must see this front line, absolutely, and have some insight to share in that regard. So if you could, for people who are new to cannabis here, and perhaps those who could use a refresher here on the subject, this experience of the cannabis high and the euphoria around it, is it dangerous, and can anyone die of an overdose of cannabis?
It's my experience that no one dies from an overdose of cannabis. You can get extra sleepy, extra hungry, but you're not going to ever die. The opioids that we're so concerned about right now are affecting our brainstem, and cannabinoid receptors are not there. And so it isn't possible for us to die from an overdose of cannabis. And so a lot of the fear out there is just fear. It's just making people just be afraid for all the wrong reasons.
Absolutely. Dr. Dave, maybe you can speak to some of the conditions, pain conditions that cannabis can be used for in this context. And are there some unintended, I'll make it a two-part question, are there some unintended consequences of introducing cannabis as an option?
I don't do two-part questions, because I forget the second one.
Fair enough.
So yeah, make it a seven-part, and I'm more like, you're right though. There is a massive opiate crisis, and just to underscore, I don't know if the numbers have been given yet today, but in the States alone, there are 47 people per day dying from prescription opiates, and if you added non-prescription, you're over 80 a day dying. And one of the interesting things is that 10% of Americans suffer from chronic pain, and of those, I should say 3 to 4% of them are on opiates for chronic pain. So you think about that and you realize, Zach Walsh was talking about a study earlier saying that states that had medical cannabis had a 25% reduction of opiate-related morbidity and mortality. What he should also to add to that, in that study showed that the longer that state had medical cannabis, the greater was the reduction of, in fact, the opiate-related mortalities and morbidities. But you ask about conditions that we try and treat, and this is what we do. I mean, medicine is about pain. But in so many things, what we're trying to do is just try to put a bandage on it, and here you have pain, we'll give you something for pain. And unfortunately, it's like I always think it's the mechanic who said, I couldn't fix your brakes, so I made your horn louder. And in some ways, that's what we're doing, is we're just trying to, we don't necessarily deal with the problem. So if it's like a fibromyalgia issue or others of that nature, we just try and mask it with painkillers very often, because we're not really sure how to treat the condition. This is why that CHCE, that clinical endocannabinoid deficiency syndrome, I think is going to be so vital to come up and prove one day. Hopefully it won't be too long. But once we can do that, then we can sort of be able to part and parcel the conditions themselves, and not just continue to prescribe medications just as a Band-Aid.
Yeah, absolutely.
I didn't answer your question. I didn't know what your question was.
And we'll get to the second part. I mean,
right.
Looking at the introduction of cannabis in a lot of treatment regimens, I mean, what are some unintended consequences that patients and their families can face?
Okay, so I think that they're concerned about whether they're going to have addiction issues. They're concerned about odors and smells. I mean, it ranges from every situation as the unintended consequences, I would say. I mean, who was it earlier? Dave Hutchinson was saying that the one side effect they're concerned about is too much happiness. So yeah, there are. I would say that again. I think of a patient. Here's actually one I just thought of. It's an MS patient came in to see me and put her on cannabis. Came back a month later. I said, "How's the pain?" She goes, "The pain in my leg is so much better, as is the pain in my stomach." And I don't recall that. But the fact was, she says, "Yeah, I don't have to take those other medications I was taking for my stomach previously, and they were causing me grief." So again, you see that cascade effect from things happening just like that. Sometimes anecdotes do make for the most interesting, poignant stories. And another lady who was a well-known artist in the country at galleries, and she came in and she had not been able to paint for 2 years because she had a right-sided peripheral neuropathy of her arm. And so, again, reticent to go on cannabis, doesn't jaywalk, that kind of person. Talked her into taking this, and she came back a month later, and my MOA secretary came and said, "Mrs. So-and-so is here to see you, as is her husband. He's a lawyer, and he wants to talk to you first." Great. Those are scary words, but he came down the hall, and he came in and into the room, and he just reached up and he shook my hand. He said, "Thank you for your courage and your compassion." He said she's not only is she painting again, but she's sleeping again because her anxiety was so bad that she couldn't make a living for 2 years. So again, those are, I would say, there's a cascade effect sometimes to really helping people in this manner. I don't know if that answers your question. But
yeah, no, absolutely. Thank you. And that brings us to an interesting intersect point of the legality of all this and the administration of it and how that all works. Dori, at your locations, I mean, is that something of concern for a lot of the member base there in terms of how the interaction with the law occurs and what their rights are?
I'm not sure what you're asking.
Well, just in terms of the law and the legality and access around cannabis, is that something that you get a lot of questions about as a frontline operator?
Yes, and there's a lot of confusion. A lot of confusion, because a lot of people think that it's just legal and they can be using it, and they don't understand that they've been using it maybe for the last 5 years and it isn't as legal as they thought it was. But yeah, there's lots of confusion.
And with the subject of pain in particular, do you try and connect them with solution providers, medical professionals, and
What we try to do at the dispensary is not necessarily connect people to certain people, but we try to connect them to their own doctors and their own healthcare providers, because we want them to be treated in a whole way. And we think that just going out and seeking one doctor for one thing isn't maybe going to help them in the best way. They need to be looking at everything that they've got, and best to start with your own doctor.
Yeah, no, absolutely. And again, being a frontline operator, you get to just see the confusion really across a wide demographic of people. Educated, non-educated. The subsections. It's all there. The ignorance, indifference, and inertia around getting informed about cannabis and your rights, even as a patient where this is a vital medicine, it can be quite lacking sometimes. And it's just really, the information that's available and the people at the front counter sometimes that make all the difference, and connecting them with associations, like Cheryl as well. Can you speak to that a little bit for perhaps, parents and that sector? Because we're dealing with an interesting dichotomy here in terms of conversation. We have, cannabis and pain, and then there's also this sub-conversation of parents and children, and that kind of intersect between the legality is interesting. So some insight and advice to parents. And
I run across parents all the time that want to try it for their children, but are having like impossible times finding doctors willing to try, even though our laws allow for doctors to prescribe. Doctors are still afraid to prescribe. They don't have the knowledge that they want, and many of them want it, or they don't want to know anything about it because they don't have enough knowledge to feel comfortable in even discussing it with you. And so we come across a lot of patients over the years. It's getting better now, but there's still, even with the new program, there's still a lot of flaws that leave many families in that zone where they're not legal. And we see them all too often. They've been trying different things and they're doing their very best, but they don't want to wait to find someone for, one more option for their child who is extremely ill and at any time could, pass on them. There is no, with severe epilepsy, there's no rhyme or reason. Your child could be having a great day, have even a small seizure, and you lose them. No parent wants to wait on that. And it's the legalities around it and where they're left is really disgusting, because they're not getting that help they need. And like Dori, you see it all. We've all seen this situation. So we do get them where they're in that zone, and so we will advocate for them with their doctors, try to get their doctors on board, or find a doctor that will sign for their cannabis and overlook the cannabis regime. But we really want that open door with their doctors, just so that we can exchange information and get the best possible care, because that's really what it's all about. So
yeah, absolutely. And I find an important part of that conversation often entails, the quality assurance and the standards around what solutions the doctors could potentially offer or explore even. Phil, maybe you can speak to this a little bit about, some of the differences around pharmaceutical drugs versus cannabis, the quality and the level of kind of professional production standards that are around those solutions, and why maybe there's some uncertainty in the medical field to engage cannabis.
Well, it's definitely interesting for sure. And I think a lot of it has to do is the way that it's presented between pharmaceuticals and cannabis. At the end of the day, it becomes down to the doctor's responsibility to make patients like myself or Hayley feel comfortable about the direction that we're going. And it's in a lot of circumstances with pharmaceutical drugs, we've been taught and accepted to approach it in a different manner, where we've been brought up to learn that cannabis is not accepted and it's a gateway drug. But it's with so many understandings now where we're at today, it's we're stopped in progression of time, and it's we're not willing to progress forward. So at the same time, it really depends on the state of where the doctors and the treatments lie. But between the two differences is like there's many pharmaceutical drugs that don't cure anything. But it's like we look at myself even with MS drugs, it's like MS drugs are so harsh to the health, and it's like I might not even get cured from MS, or it might not even stop a relapse. But it's like I'm not saying cannabis is going to do that either, but it's like with less side effects with cannabis in the way that I use it, is like I feel more comfortable doing that versus using an MS drug that I might have thyroid disorders, I might be failed to even wake up one morning. Or it's like I look at it, it's like the treatments that it persists of even using something like prednisone, where it's like I might be highly allergic to that, but it's like cannabis is not an option for me. It's just a little contradictory to the point.
Mm-hmm. So in terms of some of the standards, though, that these products are created under, I mean, like, as a producer, I mean, you must see some of the worst in some cases. What are some concerns that you've kind of seen that you can kind of raise profile for patients out there kind of seeking these as viable medical solutions?
On the cannabis side or the pharmaceutical side?
On the cannabis side.
On the cannabis side, well, definitely in Canada, is like we're faced with situations where it's not fully legal yet. It's still a Schedule 1. And since it's not readily accepted in such other ways like in the United States, it's difficult sometimes to maintain a certain standard. But at the end of the day, I believe that many dispensaries and producers, whether they're extracts or bakers even, produce the best way they possibly can, or in circumstances like where Cheryl's in, they do the best they can to provide in cleanliness as much as they can, really.
Mm-hmm. And as an operator, I mean, what do you look for in terms of the products and solutions that you offer front counter to patients that are in medical need? What kind of standards are kind of salient in your mind to look for?
Well, the first rule is if I wouldn't use it as a medicine, I won't put it out as a medicine for any of my patients or clients. We want to know who our growers are. We want to know where the medicine's coming from. We want to know the methods that people are using. We want to know what love gets mixed into their cookies because we think that that's important.
Mm-hmm. Yeah, and again, pain is just such a common a need out in the community when it comes in the door. It's it's chronic, it's acute, it's as a result of a long-term injury or illness. And Dr. Dave, maybe you can speak to some gaps that you see on the medical side from some of these cannabis solutions for pain, just not building confidence in the medical community for really looking at them for long-term care.
Well, I agree with Dori as well, is that I don't prescribe any medications to patients unless I try them first. So I'm trying them all right now. It has been great, except for the estrogen thing. That one went backwards on me here. But it's. But let me ask you this. So we're talking about pain and opiates here. What do you think is the most, just you guys, what do you think is the most effective analgesic of the cannabinoids? You think it's CBD, THC? Which one do you think it is? What's that?
THC.
Did I say THC? No, it's not. Pardon me? It's up there. Yep. No, it's actually CBG. Again, so it just shows you how far we have to go to really find out what it is. People say, well, how much pain, sort of, can I expect to have a reduction of? And my rule of thumb, because there's a couple different studies that show that 10 milligrams of THC is about equivalent to 4 Tylenol 3s. So it's not like Dilaudid and fentanyl and morphine, things like this. So you have to be able to realize that it also potentiates the effect of the opiates that you take. The studies have shown that. And it also adds to your own endogenous opiates to help elucidate those. So again, there's a gap in understanding what is the best cannabinoid, how we best utilize it. I have a protocol now when I teach physicians of how to take patients off of opiates, because that's the number one question I tend to get is how do I get Mrs. Bloggins off her fentanyl or her morphine or whatever. So there's a protocol that I use, and it does involve primarily THC right now. It's about a 5-to-1 THC CBD ratio that you take at night, and you gradually, there's a whole protocol that I do. But I think that's it's a huge gap. We don't know the answer to that. And so who fills in these gaps? Well, somebody from Hornby Island who has got a lot of experience on it. But however, you have to sort of combine experience with science, and that's a real gap. You're right, Andrew. It's a tough gap to fill in, and we just have to do what we can to continue. The answer to half the global problems is education. But right now, patient comes in, we throw them an iron life jacket. you know, we think we're doing something to help them, but sometimes we make it worse, particularly with these opiates as we get people, you know, hooked on them. There's no doubt about it. Post-op, it's a real problem. Patient comes in, she's never had opiates before. She goes on a post-op regimen and doesn't come off, and then ends up in treatment. So, big problems.
Yeah, no. You know, looking at some of the challenges as well around that, you know, the experience and the solution is administration. And I find, you know, a lot of where, you know, problems arise, in particular when patients come back or members come back and they're, you know, expressing concern about an adverse effect or something, it's really all about, you know, how they administer the education they received at the time of, you know, purchase or acquisition. So perhaps, Cheryl, you know, what are some of the common questions that parents or adults even come to you with in terms of administering some of these solutions? Suppository,
Yeah, we
admixture.
get all different ones, sublingual, capsules, topicals, suppositories, and inhaled. For pain, what I deal with personally, hands-on with Hayley, is she takes her staple medication for her epilepsy of her cannabis 3 times a day in capsules. Well, every now and then she'll have pain or headaches and stuff. Now, Hayley also consumes other pharmaceutical medications, so I don't like to give her extra Tylenol and Advil and other ways to have to deal with that pain. So what we do is we give her it inhaled, which allows for a quick, fast-acting thing, and she can regulate it herself as often as she needed. And it doesn't seem to affect her quite in the same way as if I were to increase her oral dosing. If I were to increase her oral dosing, we actually see, because she's right at her perfect dosing for her medical cannabis for her epilepsy, we actually see, oh, well, we can tell that it's a little off, whether it's effects from the CBD and the THC. We do see, no, that's a little bit much. We got to pull back that dose, just as you would with any other regular drug other type of drug you were on a regular regime. So by giving her the vaporized or topical on her muscles, especially in her particular case, it aids and is supplemental for a secondary condition, which is that pain that she's suffering from due to, it could be because of her bone density issues or, like I said, from headaches and such. And we find that works really, really well to supplement for her. So you can actually use cannabis for, obviously, as we all know, for multiple conditions, but depending on the way you administer it, you can benefit from relief that doesn't negatively impact your regular dosing regime for whatever other condition you're serving it for.
Okay. Wow, okay. You know, looking at, you know, the complexity of that and the administering of it, I see, you know, a big challenge emerging in terms of that frontline education. And I'd like to see more, you know, events like this, obviously, and the people in the community that are part of it to have an interchange of ideas at the counter. I find, you know, dispensaries are a wonderful hub of exchange for solution providers and operators and patients and licensed medical professionals to really breed an understanding of not only where we are now and where we've come from, but where we're going here, and looking at long-term solutions, but also checking understandings. I think that's an important part of it. And, you know, cannabis is often looked at as a cure-all or sold as a cure-all, and I think, you know, part of these events can be about sobering our understandings of that and putting them in context with scientific understanding. And Dr. Dave, you do a great job of helping to bridge that and make it accessible. But at the front counter, Dori, I mean, what solutions for pain are you seeing, you know, being met or not being met from solution providers, you know, in the concentrate market or you know, edibles or whatever?
I was very happy last year to finally get suppositories. Sorry. Very happy last year to finally get suppositories. That was one of my requests for a very long time. And I'm seeing that there's lots of really great solutions out there for people. I would like to see more solutions where there's less sugar involved in helping it go down in the edibles department. and I'm sorry, I've lost, I think, the question.
Oh, just looking at some, the solutions that are there in your mind that you have available in your space, or ones that you'd like to see meet that need for pain that you see come in the door.
Yeah, I think the suppositories has been a really big leap in helping people find a solution to some really deep pain that they haven't been able to find solutions for. The first person that I heard back from was a lady that had cancer of the uterus, and she had done everything that they had suggested to her, and she was about ready to take her own life because it was just so bad. And it took one 250 milligram suppository to change her decision about what she was going to do with the rest of her life. And she's been able to really help herself in a really big way. And when you get those hugs from their partner to say, she wants to live now, it makes a really big difference. So I think if people aren't finding the solution, they need to just keep asking, and they need to keep asking their friends, and they need to keep asking other people, and keep trying. If you haven't found what works for you, keep trying, because there is a solution out there, and sometimes it's a combination of them.
Yeah. And it is important to ask questions. I do encourage you all to do that, and encourage your friends and family to do the same, because there are better solutions out there. There are better solutions emerging, and being a part of the conversation front line is important as a consumer, as a patient, as a family member, a concerned person as building our community here. We are getting short on time, though. I do have one closing question, though, because your mission is all about developing clean, medically tested concentrates and solutions. And suppositories being one of the solutions that as a frontline operator, I also was excited to get a hold of because of the absorption rate and the pain management and being lucid and getting off fentanyl patches and things like that. That's serious for patients and families at end of life care and palliative situations. So. Some insight from you in terms of, because suppositories are often susceptible to that. I know if they're not made in a really sterile, clean environment, that they can introduce bacteria and cause some problems for patients. So as part of your mission in terms of educating the public about looking for clean and medically tested concentrates, what advice would you give in closing?
For medically tested concentrates, I would definitely be asking your dispensaries, if it's solventless, what's the flower test back at? Were there pesticides? Because just because it's solventless doesn't mean that it can't be harmful. And there's a lot of confusion sometimes about what a residual solvent is and residual solvent testing. And at the end of the day, it's solvents aren't a dangerous thing. And at the same time, it's solvents are used in practices all across both industries in Canada and the US. But for looking for quality on even a solvent product, I would definitely be asking for a residual solvent test and just asking to see the cannabinoid profiles and just how it was processed. And the most important thing is finding out what solvent your extractor actually uses. Are they using cans of butane they got from 7-Eleven, or are they using things that they ordered in? Because at the end of the day, it's we should be acting like any other industry. And for solvents specifically, it's we should be required to go get solvents that meet a certain standard. Otherwise, we're doing no better than other harm.
Yeah, no, absolutely. That's good advice. And I'd like to thank all the panel for their insight and for your time and attention. Unfortunately, we notified we don't have some time for questions, but you are welcome to connect with our panelists. You can come connect with them either after this or email them. Their information is available. So I wanted to, again, thank you all, and we'll enjoy the rest of the conference. So thank you very much.